with the webinar.
Thank you so much, sir.
Over to you, Harish.
Thank you so much, sir. All the doctors, welcome you all for the today's webinar. I would like to introduce about Dr. Ritu Santwani. Dr. Ritu Santwani is a 20 years veteran of the obstetrician and gynecology services. She is specialized in the cosmetic gynecology and test tube baby and each and every aspect of infertility and provides a comprehensive services in IUI, IVF, assisted hatching, egg donation, embryo donation, surrogate motherhood, male infertility, natural infertility treatment, semen banking, embryo freezing, sexual and psychological problems, along with the cosmetic gynecology treatment. She is expert in PRP therapy and try to give moral and emotional support to our infertility patients. Dr. Ritu Santwani is excellent interpersonal communication skills to interact with the patients and she is a strong ability to work under extreme pressure during the handling critical cases. So I would like to welcome Dr. Ritu Santwani for the today's presentation on female sexual dysfunction and its management. Welcome to me.
Yeah. Thank you so much, Harish, and thank you, Mr. Verma, for the kind introduction. A very good afternoon to all of you. I am very much thankful all of you have taken out your precious time in this afternoon. A big hello to Dr. Jumani and Sir. Thank you so much for the joining. I am really honored that such stalwarts are also joining my webinar. I can see Dr. Ashima from Jalandhar, Dr. Rimmi from Ludhiana, Dr. Anupma Gopal. Thank you so much. Thank you all of you for the joining. So now I'm switching over directly to my presentation. We are going to discuss about the this female sexual dysfunction. Vaibhav, are you there? Vaibhav?
Yes, I'm there.
Yeah.
Just
Now you have to click hide.
presentation.
Yes. Now, acha, okay. Now you have to click hide. This button hide. The presentation.
Yes.
Yes.
Okay. You're
Yeah.
set to go.
Yes. So today I'm going to discuss regarding the female sexual dysfunction rekindles the fire. Apart from this medical management, I am going to highlight something about the PRP, what I am doing. So as all of you know, the earlier it was said the basic need is roti, kapda and makan. Now all of us know the basic need is free Wi-Fi, mobile and sex. I hope all of you must be on this with me. As we know, the sexual health is defined by WHO as the integration of somatic, emotional, and social aspects in ways that are positively enriching and will enhance the personality, communication, and love. So, as we know, the human sexuality is a multi-dimensional concept with the ethical, psychological, biological, and cultural dimensions. Sexuality reflects the human character and the way in which the people interact. Sexuality is a lifelong process of acquiring information and developing values about one's identity, relationships, and intimacy. It includes learning sexual development, reproductive health, interpersonal relationships, affection, body image, and gender roles. So, the main organ that affects the male and female sexual response is the brain. The activated areas at the time of the sexual arousal are the media insula, anterior cingulate cortex, hippocampus, striatum, nucleus accumbens, hypothalamus. While the inactivated areas are reported amygdala, frontal cortex, prefrontal cortex, and temporal lobe. The prefrontal cortex is responsible for the control mechanism. So now we are coming to the topic for this female sexual dysfunction. So earlier it was think that only the male sexual dysfunction. Now lot of patients we are getting for this of the female sexual dysfunction also. As the studies have shown, the 40% of the women struggle with sexual dysfunction. The National Health Survey shows the study that 43% of the women aged less than 60 years had some form of the sexual dysfunction. Earlier, the patients are not approaching us for this, but now in the metro cities, we are getting the patients. Lot of patients are coming and booking the appointment for the sexual dysfunction. In the female sexual disorders, we categories like first is a female sexual arousal disorder, female orgasmic dysfunction, female sexual desire disorder, and female sexual disorder. So as I already mentioned, the sexual dysfunction is about 43% in the women. It is more prevalent in the females compared to the male. In the males, it is reported up to 31% and increase in the woman age. Married women have a lower risk of the sexual dysfunction than unmarried women. There's a one beautiful slide I've got which shows how much is the prevalence rate. In this, you can see we have shown the all of the study has done, which shows in all the phases of the sex the desire, excitement, erection, orgasm, and total dysfunction. So overall, if we see how much is the incidence is more prevalent is coming in the females. So the nutshell of that is 21 to 28% hypoactive sexual desire disorder, 28% is the arousal, 23% is the lubrication difficulties, 21% female orgasmic disorder, and 26% are the pain disorders. So the factors that directly affect the female sexuality: age, physical and emotional health, education, quality of the relationship with the partner, sexual performance of the partner, and the hormonal status. So as we know, it is a multifactorial age progressive problem. It is a persistent recurring decrease in the sexual desire or arousal and the difficulty or inability to achieve an orgasm or the feeling of the pain during the sexual intercourse. So this all is going to be correlated: sexual arousal disorder, pain disorder, orgasmic disorder, and hyperactive sexual desire disorder. As we know, this slide can itself